I am Dr. Rebecca Sloan, a urologist specializing in male reproductive health, vascular mechanics, and clinical endocrinology. Almost every single week, a patient sits across from my desk, pulls out his smartphone, and asks me about some miraculous 1-minute bathroom trick he saw advertised on the internet, hoping it holds the secret to curing his erectile unpredictability. Most of what circulates online is sensationalized nonsense, designed to prey on the anxiety of men who are desperately looking for a solution. However, as a clinician who relies strictly on evidence-based medicine, I have to admit a profound irony regarding this specific internet myth. Beneath the exaggerated claims and the clickbait titles, there is actually a robust foundation of physiological truth. There is, in fact, a highly specific 1-minute routine you can perform in your bathroom every morning that fundamentally alters the way your vascular system operates, directly impacting your erectile tissue. It is not a magic spell, and it is certainly not a gimmick. It is pure, unadulterated vascular mechanics, rooted in the complex biology of the human circulatory system. Today, we are going to strip away the internet noise and look at the exact science. I am going to explain exactly what is happening inside your blood vessels, why the conventional treatments you have been relying on are likely failing you, and how a targeted physiological reset can restore the mechanical function of your tissue. Erectile unpredictability is perhaps the most deeply isolating condition a man can experience, and if you are dealing with this silent frustration right now, you need to understand that you are far from alone. I see thousands of men in my clinic who sit in the patient chair feeling utterly broken, convinced that their body has simply aged past the point of no return, completely unaware of the underlying vascular mechanism that is actually causing the failure. Standard 15-minute medical consultations simply do not afford physicians the time to sit down and explain the complex biology of what is happening to your tissue on a cellular level. I am going to give you that time right now, and I promise you that by the end of this video, you will understand the exact mechanics of your own body better than the vast majority of doctors you might visit. To understand how to fix the problem, you first have to understand the fundamental architecture of an erection, because the vast majority of men, and even many general practitioners, fundamentally misunderstand what an erection actually is. It is not merely a mechanical event. It is a profound hemodynamic and biochemical phenomenon. Your penile tissue consists of two cylindrical chambers called the corpora cavernosa. These chambers are filled with a spongy network of smooth muscle and blood vessels. The critical component of this entire system is the endothelium, which is the microscopic, one-cell-thick inner lining of your blood vessels. When your brain sends a signal of arousal down your spinal cord, it reaches the nerve endings in the pelvic floor. These nerves release chemical messengers that stimulate the endothelial cells to produce a gas called nitric oxide. Nitric oxide is a powerful vasodilator. It floods the surrounding smooth muscle, causing it to relax completely. As the smooth muscle relaxes, the arteries dilate massively, allowing a rush of pressurized blood to fill the spongy chambers. As these chambers expand, they physically press against the veins that normally drain blood out of the penis, effectively trapping the blood inside. This biological mechanism is known as the veno-occlusive mechanism. The problem that occurs as men age is not simply that they lose their desire, but that their endothelial cells become damaged and dysfunctional. Years of low-grade systemic inflammation, elevated blood sugar, stress, and poor sleep create oxidative stress that physically scars the delicate lining of your blood vessels. The endothelium loses its capacity to produce sufficient nitric oxide. Without adequate nitric oxide, the smooth muscle cannot fully relax. If the muscle does not relax, the arteries cannot dilate enough to bring in the necessary volume of blood, and the veins are never compressed. The result is a weak response, an inability to maintain rigidity, or a complete failure to initiate the process. This condition is known clinically as endothelial dysfunction. Data published in major medical journals, including extensive studies reviewed by institutions like the Mayo Clinic, have repeatedly demonstrated that erectile dysfunction is almost always a vascular issue first. This brings us to the fundamental reason why conventional medications often fail or lose their efficacy over time. The most commonly prescribed synthetic pills, the ones belonging to the class of PDE5 inhibitors, do not actually create erections. Their mechanism of action relies entirely on preventing the breakdown of a chemical called cGMP, which is triggered by nitric oxide. Here is the critical flaw that most patients do not realize. These medications require your body to produce a baseline level of nitric oxide to work in the first place. If your endothelium is so damaged that it cannot produce the initial surge of nitric oxide, the medication has absolutely nothing to amplify. You can take the highest dose legally allowed, and it will still fail, leaving you dealing with facial flushing, severe headaches, and blurred vision, but no functional result in the bedroom. The most frequent and tragic error I see patients make is perpetually increasing their dosage of these synthetic pills, hoping for a different outcome, while completely ignoring the degradation of their vascular lining. You cannot force a damaged biological system to perform by flooding it with synthetic chemicals. You have to rehabilitate the tissue itself. The practical protocol I am about to share is the clinical reality behind the so-called 1-minute bathroom trick. It is a sequence of habits designed specifically to rehabilitate endothelial function, force vascular adaptation, and optimize the pelvic musculature. The first component addresses the peripheral vascular system through thermal manipulation. Your vascular system is highly responsive to temperature, a mechanism controlled by the sympathetic and parasympathetic nervous systems. When you are finishing your morning shower, you can utilize a technique known as contrast thermal shunting. By exposing your body to 30 seconds of cold water, you trigger an immediate sympathetic nervous system response. The smooth muscles in your peripheral blood vessels forcefully contract, a process called vasoconstriction, to push warm blood toward your core organs. The moment you step out of the shower and your body begins to warm, the parasympathetic nervous system takes over, causing a massive rebound effect called reactive hyperemia. The vessels dilate forcefully, flushing oxygen-rich blood back through the microscopic capillaries, including those in the pelvic region. This rapid contraction and dilation acts like a targeted cardiovascular workout for the smooth muscle in your arteries, helping to restore elasticity to the endothelial lining over time. It requires no equipment, takes less than a minute, and utilizes your body's inherent thermoregulatory reflexes to improve vascular flexibility. Before we move on to the specific anatomical mechanism you must isolate, I want to take a brief moment to ask for your support. If you are finding this level of clinical detail valuable, please take a second to subscribe to the channel and like this video. This specific type of evidence-based medical education, stripped of marketing and sensationalism, is something that fundamentally belongs in the doctor's office, not just on the internet. By engaging with this content, you help the algorithm push this critical vascular information to other men who are currently sitting in silence, believing that their physical decline is inevitable. The second component of this daily protocol moves beyond the blood vessels and targets the specific mechanical musculature that controls the outflow of blood. Many men are familiar with the concept of pelvic floor exercises, often generically referred to as Kegels, but they perform them entirely wrong. Simply squeezing the general pelvic region does very little for erectile mechanics. The specific muscle you must target is the ischiocavernosus muscle. This small, highly specialized band of muscle wraps over the base of the pineal tissue. Its sole biological purpose during an erection is to forcefully contract and compress the deep dorsal vein, the primary exit route for blood. If this muscle is weak, you develop what urologists call a venous leak, where blood flows in but immediately drains back out, making it impossible to maintain rigidity. You can isolate this muscle while standing in the bathroom by attempting to contract the specific area right at the base of the anatomy, as if you were trying to make the tissue jump or lift without tightening your glutes or your abdomen. Performing 10 slow, highly focused contractions every morning fundamentally rebuilds the mechanical strength required to maintain the veno-occlusive mechanism. It is a precise anatomical intervention that addresses the physical structural integrity of the erectile process. The third component is biochemical priming. As I explained earlier, nitric oxide is the master molecule of male vitality. While the endothelium produces it internally, you can also supply the building blocks externally through a process called the nitrate-nitrite-nitric oxide pathway. This pathway begins in the mouth. Certain dark leafy greens, particularly spinach and arugula, as well as beetroot, are rich in dietary nitrates. When you consume a concentrated source of these nitrates in the morning, such as a cold-pressed beet juice shot, the commensal bacteria residing on the back of your tongue immediately convert those nitrates into nitrites. Once swallowed, the acidic environment of your stomach and the specific enzymes in your blood convert those nitrites directly into circulating nitric oxide. This provides an exogenous supply of the exact vasodilator your damaged endothelium is struggling to produce. It lowers systemic blood pressure and primes the vascular tissue for the entire day. For years, I stubbornly resisted incorporating any form of supplementation into my clinical recommendations. My training was deeply rooted in conventional medicine, and my philosophy was always to rely exclusively on lifestyle modifications, dietary shifts, and, when absolutely necessary, targeted pharmaceutical interventions. I viewed the supplement industry with an immense amount of skepticism, primarily because so much of it is unregulated and lacks rigorous clinical backing. However, as a physician, you must let patient outcomes dictate your practice, not your preconceived biases. I began noticing a distinct pattern in my clinic. The mechanical and dietary habits I just detailed produced excellent results for many men, but there was a specific subgroup of patients, typically men between the ages of 58 and 67, whose response was frustratingly slow or entirely incomplete. It was not a lack of discipline on their part. Their vascular endothelium was simply too rigid, and the systemic inflammation too chronic for physical habits alone to bridge the physiological gap. Their tissue required a deeper level of biochemical scaffolding to initiate the repair process. This clinical plateau forced me to dive into the pharmacological literature regarding natural compounds, and I eventually found a specific combination that I began testing and later fully integrated into my patient protocols. The formulation relies on two primary mechanisms. The first involves an active compound called Icariin, derived from epimedium. Icariin functions as a natural PDE5 inhibitor. It works on the exact same enzymatic pathway as the famous blue pills, preventing the breakdown of the erection-sustaining chemicals. But it does so gently, without the aggressive synthetic blockade that causes the severe headaches and visual disturbances. The second critical component is alpha-lipoic acid. This is a potent fat and water-soluble antioxidant that specifically targets the peripheral vascular system. It neutralizes the reactive oxygen species that physically damage the endothelial cells, effectively reducing the localized inflammation that makes the blood vessels stiff and unresponsive in the first place. In men between 58 and 67 who had previously hit a plateau, I have consistently observed a measurable shift in vascular responsiveness within 3 to 4 weeks of introducing this specific biochemical support. It is important to understand that this is not a medication. It is highly targeted nutritional support with a heavily documented biological mechanism. Because purity is my primary concern when discussing any natural compound, I only recommend formulations that have undergone independent laboratory testing to verify the complete absence of heavy metals, synthetic drug analogs, and bacterial pathogens. I have placed the link to the specific formulation I use in my clinical practice in the pinned comment below the video. You can access it there, review the clinical literature, and evaluate the precise composition of the ingredients for yourself at your own pace. Understanding this biological mechanism is about far more than just restoring bedroom performance. It is about recognizing the profound interconnected nature of your vascular health. The microscopic arteries in the penile tissue are only 1 to 2 millimeters in diameter. The coronary arteries feeding your heart are 3 to 4 millimeters in diameter. Because the pelvic arteries are significantly smaller, they are almost always the very first vessels to become blocked or damaged by endothelial dysfunction. In the medical community, we view erectile unpredictability as the canary in the coal mine. It is a highly accurate leading indicator of systemic cardiovascular disease. If the endothelium in the pelvis is failing today, the endothelium in the heart and the brain is already under severe stress. Furthermore, if this localized vascular issue is left unaddressed, the tissue itself begins to permanently alter. Healthy erectile tissue requires regular, oxygen-rich blood flow to survive. Men naturally experience several erections during the deep REM cycles of sleep, which serve as a physiological maintenance system, flooding the spongy tissue with oxygen. When endothelial dysfunction prevents these nocturnal events, the tissue becomes chronically hypoxic, meaning it is starved of oxygen. Over time, the smooth muscle cells literally begin to die and are replaced by inelastic collagen, a process known as penile fibrosis. The tissue loses its ability to expand, permanently altering both function and physical size. I have observed in my clinical practice that men who take the necessary steps to rehabilitate this specific vascular pathway do not merely recover their intimacy. They frequently report a dramatic return of cognitive clarity, sustained physical energy, and a general restoration of vitality simply because they have repaired the systemic microvascular network that feeds every organ in their body. We have covered a significant amount of complex physiological information today. We have established that the root cause of these failures is rarely age alone, but rather the degradation of the endothelial lining and the subsequent loss of nitric oxide production. We discussed the specific thermal, mechanical, and biochemical habits required to rehabilitate that tissue, from contrast thermal shunting to the precise isolation of the ischiocavernosus muscle. Tell me in the comments below, have you ever noticed a correlation between your general morning energy levels and the predictability of your erectile function? The human body possesses a remarkable degree of biological plasticity, which is the inherent capacity of your tissues to heal, adapt, and restore function when provided with the correct stimuli. However, regarding the smooth muscle of the vascular system, that window of plasticity steadily narrows as fibrotic tissue begins to accumulate. Intervening while the tissue is still responsive is the key to reversing the mechanical decline. The nutritional support protocol I discussed earlier is specifically designed to amplify these exact physiological adaptations, providing the precise biochemical environment your endothelium needs to heal when habits alone are no longer sufficient. The link is located in the pinned comment below for you to examine the science and the composition directly. Ignoring a localized vascular warning sign does not cause the biological decay to pause. It simply guarantees that the eventual repair will require far more drastic and invasive medical intervention.